Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. In recent times, I have noticed many new parents coming up with a prepared list of queries in mobiles regarding baby's first days, especially urination and bowel movements. I am addressing all those queries in this video, so better you watch this till the end. Many new parents wonder what's normal and what's not when it comes to diapering their newborn. Here's what you can expect during your baby's first few days. First, we'll see the queries regarding urination. In a healthy child, urine is light to dark yellow in color. The darker the color, the more concentrated the urine. The urine will be more concentrated when your child is not drinking enough milk. Your baby may urinate as often as every 1 to 3 hours or as infrequently as 4 to 6 times a day. If they are ill or feverish or when the weather is extremely hot, their usual output of urine may drop by half and still be normal. In the first week after birth, you may see a pink or brick red stain on the diaper, often mistaken for blood. In fact, the stain is usually a sign of highly concentrated urine which has a pinkish color. As long as the baby is wetting at least 6 to 8 diapers a day, there probably is no cause for concern. If the pinkish staining persists, consult your pediatrician. Newborn girls may have a small spot of blood in the diaper, also usually in the first week after birth. This blood is caused by her mother hormones affecting the baby's uterus. After that time, however, the presence of actual blood in the urine or a bloody spot on the diaper is never normal and your pediatrician should be notified. It may be due to nothing more serious than a small diaper rash sore, but it also could be a more serious problem if this bleeding is accompanied by other symptoms such as abdominal pain, poor feeding, vomiting, fever, or bleeding in other areas. In those cases, seek medical attention immediately. And urination should never be painful. If you notice any signs of distress while your infant is urinating, please inform your pediatrician. This could be a sign of infection or some other problem in the urinary tract. Now, we'll see the queries regarding the bowel movements. For the first few days after birth, your baby's first bowel movements will be a substance known as meconium. This thick black or dark green substance filled their intestines before birth, and once passed, the stools turn yellow-green. Baby stools vary in color and consistency due to their immature digestive system. If your baby is breastfed, their stools soon should be yellow liquid mixed with some particles. Until they start to eat solid foods, the consistency of the stools may range from very soft to loose and runny. If they are formula fed, their stools usually will be tan or yellow in color. The stools will be firmer than a breastfed baby's but should be no firmer than soft clay. Green stools are not unusual either and they should not cause you alarm. Whether your baby is breastfed or bottle fed, hard or very dry stools may be a sign that she is not getting enough fluid or that she is losing too much fluid due to illness, fever or heat. Once solids are introduced, hard stools might indicate that she is eating too many constipating foods such as cereal or cow's milk before her system can handle them. Whole cow's milk is not recommended for babies under 12 months. Here are some other important points to keep in mind about bowel movements. Occasional variations in color and consistency of the stools are normal, and if there is a minor irritation of the anus, streaks of blood may appear on the outside of the stools. For example, if the digestive process slows down because of the foods requiring more effort to digest, such as large amounts of cereal, the stools may become green. Or if the baby is given supplemental iron, the stools may turn dark brown. However, if there are large amounts of blood, mucus or water in the stool, call your pediatrician immediately. These symptoms may warrant attention from your doctor. Because an infant's stools are normally soft and little runny, it's not always easy to tell when a young baby has mild diarrhea. The telltale signs are a sudden increase in frequency to more than one bowel movement for feeding and unusually high liquid content in the stool. Diarrhea may be a sign of intestinal infection or it may be caused by a change in the baby's diet. If the baby is breastfeeding, they can even develop diarrhea because of a change in the mother's diet. The main concern with diarrhea is the possibility of dehydration. If fever is also present and if your infant is less than 3 months old, call your pediatrician immediately. If your baby is over 3 months and the fever lasts more than a day, check their urine output and rectal temperature and then report your findings to your doctor for consideration. Make sure your baby continues to feed frequently. The frequency of bowel movements varies widely among babies. Many pass stools soon after each feeding. This is a result of the gastrocolic reflex, which causes the digestive system to become active whenever the stomach is filled with food. By 3 to 6 weeks of age, some breastfed babies have only one bowel movement a week and still are normal. Breast milk leaves very little solid waste to be eliminated from the child's digestive system. Thus, infrequent stools are not a sign of constipation and should not be considered a problem as long as the stools are soft and your infant is otherwise normal, gaining weight steadily and nursing regularly. Babies with this breastfed stool variant usually have a large volume of stool if it has been a few days. If your baby is formula fed, they should have at least one bowel movement a day. If they have fewer than this and appear to be straining, they may be constipated. So ask your pediatrician how to handle this problem. And this is all about first days bowel movements and urination. And thanks for watching. If you have any further queries, please do ask us in the comment section.